Hey everybody, welcome to the first episode of the Daily Dental Rewind. The whole goal of this series is going to be to stay in touch with you often and talk about cases from my days, really educate and just create community together. It's been pretty difficult over time as the office got busier for me to reach outside these walls and to have more conversations with patients or from people all over the country. So this video and these series are not really just for our patients here, but they're for anybody, looking to learn about, a variety of different things that we're going to talk about on this channel. So if you haven't already, please, subscribe down below, hit that little icon or whatever. It helps the rhythm of YouTube. I think they call it the algorithm. But let's kick the rhythm up and let's have a good time together. So this being our first Daily Dental Rewind, let's make it official. Let's run the intro. Awesome. Well, welcome back. I'm Dr. Jordon Caine Smith. From time to time, my colleague, Dr. Jarachek, will be joining me for these. But most of the time, you'll probably just get me. I've got a really interesting case from today. I had a young girl come in from about 35 minutes away from here at our practice in Broken Arrow. And she was frustrated with the way her smile looked. Now, her history was she's in her early 20s. She's in the aesthetic field. So, appearances matter in those things. And so she was frustrated because she had spent a lot of money on orthodontics several years ago. And at this point, her smile didn't look the same anymore. It had been changing over the years. I was really impressed because she came to us for a consultation in myofunctional therapy. And we'll get into that in subsequent videos, I'm sure. But to quickly just summarize what myofunctional therapy is, we are looking to assess the way the facial patterns and the muscles of our face are working. So that may be how your tongue is postured when you're at rest. It may be where, the modality of breathing, your nose versus your mouth. How do your lips stay together? All these different variables, and there's a lot to it, but the goal is to just make sure that the mouth and the facial muscles and everything are congruent, so there's harmony and that everything will be stabilized. Well, clearly for her, it hadn't been. So she came in, and I'll show you a quick video here. I'm going to cut to the screen of our viewer. And her teeth had been perfect when she had braces finished. So here's a quick shot of her mouth now. And as you'll notice, there is a large gap here in the middle of her front teeth. I would say that's 4 to 5 millimeters. She could probably put a straw through it while her teeth in the back are touching. And just to show you, we'll turn the contacts on, and you can see all these colors here show where the bottom teeth are touching the top teeth. We've got nothing in the front, and all of her heavy contact is here in the back. So she was really frustrated by the fact that she had spent this money, her teeth didn't look the same, and she had wondered why. Now, somebody along the pathway of her treatment, her dental care had told her it looked like you had a tongue thrust. Tongue thrust is just another name for a reverse swallow. All that means is instead of properly putting the tongue in the roof of your mouth and swallowing and putting all that 3 to 4 pounds of pressure into the roof of the mouth, into the palate, she has a swallow in which she pushes straight forward into her teeth. And as time's gone on, it has actually lifted the bone in the front where her teeth are. It has actually lifted that alveolar bone, and it has now basically splayed her teeth apart. So here in this picture, you can see how far apart they are. Now, I see this often in one of the telltale signs of a tongue thrust is that you'll see patients with not only a lower bonded retainer on the inside here, but you'll see one on the upper teeth. So if I turn off her lower model, you can see that her upper teeth have also got a metal wire here. So these 4 teeth have been moving together, but together they have been moving. And so lastly, I'll just kind of spin this around. These are sometimes a little hard to maneuver. I wish my screen was touchscreen here. But I'll tell you what I'll do. We're going to kick it back over. But if you look at the side here, you'll notice that her teeth are basically curving up, right? They're curving up and curving out. And so that's what's happened over time. It's just that swallow has completely changed the front of her teeth. And so she's been frustrated by that. She heard that we did myofunctional therapy, and we do. And so we did an assessment, and we're going to be starting treatment with her to actually get her tongue and her patterns of myofunctional habits back on track, so that orthodontically, if I am to help her with this again, she'll have stability and she'll have maintenance, and it won't completely open up like a garage door in the front over time. So I can't tell you guys enough how often that orthodontics are a result of poor facial growth, but poor facial growth being one of the key things that happens when we have myofunctional impairment, such as tongue thrust. So this young girl had sadly spent a great deal of money having braces done, and they looked great when they were done, but it didn't take long, a couple of years, for her teeth to completely change and for her to grow unhappy. So that's something that we're going to be really mentioning more and more about through Element 8 and talking about smile and facial development for children, but it's the same thing for adults. This young girl's in her mid-20s, and we're going to be helping her with getting this corrected too. So one of the many things we do here at Breathe Modern Dentistry and Element 8, and I'll be trying to take you down these paths, just to show you guys what we do again. That is it for today. These are going to be brief. I just worked a long day. I'm ready to get home. But I will say, if you'll leave questions or comments in the down below, we'd love to get back to these. Cassie's going to be helping me, my creative director, in communicating with you guys as well as communicating with me, so I can get your answers to the questions that you have. And lastly, you can also always text us at 918-416-0537. 918-416-0537. If you want to text message us, that's going to go directly to our app where Cassie and I can communicate with you guys directly. So if you're in Carolina or Washington, I don't care where you guys are at. You don't have to be a patient here. If we can help you and answer some of your questions about your children or yourself regarding facial development or anything dental related that we do here in our practice, don't hesitate to reach out. Thank you for joining me for the first episode of the Daily Dental Rewind. We'll see you on the next one.